Hello everyone, welcome back to LIFEHUE YouTube channel. This is the second video of our complete general medicine series. In this series, we are going to cover practical and theory topics of general medicine. So yesterday we learned about the general examination and today we are going to cover systemic examination of gastrointestinal system, cardiovascular system and respiratory system. Firstly, gastrointestinal system. So, the symptoms associated are abdominal pain, nausea, vomiting, heartburn, altered bowel habit, abdominal distension, bleeding, dysphagia, odynophagia, and loss of appetite. Dysphagia is difficulty in swallowing which may occur due to problem in oropharynx or in esophagus, while odynophagia is a painful swallowing that may limit oral intake. Abdomen examination should be performed in a systematic manner, and this includes inspection, palpation, percussion, and auscultation. Procedure should be clearly explained to the patient. After that, we start with inspection. During inspection, patient should be supine and abdomen should be adequately exposed. The inspection should be performed under proper lighting conditions. In inspection, we note down the shape of the abdomen, umbilicus, movement of abdominal wall, and prominent veins present over abdomen and skin. Shape of the abdomen may be distended or shrunken. Umbilicus may be everted or horizontal as in ascites. Movement of the abdominal wall may be absent. Visible pulsations can be seen or there can be visible peristalsis. Skin of the abdomen is shiny or smooth in marked distension. Purple striae can be seen in Cushing syndrome. Pink or white linear marks produced by cross stretching of abdomen as in ascites and pregnancy. After inspection, we do palpation, which begins anticlockwise from left iliac fossa. During palpation, we see for tender areas, organomegaly and fluid thrill. Fluid thrill detects the presence of free fluid in the abdomen. The normal note of abdomen percussion is tympanic. Percussion is useful in confirming the enlargement of liver and spleen and detecting fluid in the peritoneal cavity. Shifting dullness is a sign of moderate ascites and can be absent when the ascites is tense. The vowel sounds are heard in auscultation in iliac fossa. Now we will learn about cardiovascular system. The symptoms associated are dyspnea, chest pain, palpitation, edema, syncope, fatigue, cough, reduced urine output, and right upper abdomen discomfort. Firstly, in cardiac examination, we start with inspection and palpation. The lowermost and uppermost distinct cardiac pulsation is known as cardiac impulse or apex pulse. A thrill may be palpable in systolic phase or in diastolic phase. In apex suite, we look for character and location. In auscultation, we heard sound S1, S2, S3, S4, open snap, and murmurs. The first heard sound corresponds to the closure of mitral and tricuspid valve. It is the loud in MS and muffled in MR. The second heard sound corresponds to the closure of aortic and pulmonary valve. The presence of third heard sound in children may be physiological. The fourth heard sound occurred due to vigorous arterial contraction with a non-compliant ventricle. Opening snap is audible due to forceful opening of the mitral valve in diastolic phase preceding the murmur and heard in the case of non-calcific mitral stenosis. Murmurs are found because of turbulent flow within the heart and great vessels, and increased flow across the normal valve may also generate murmur. Murmur are generally defined by characters such as size, loudness, quality, timing, and radiation. Now, the important respiratory system symptoms are dyspnea, cough, sputum, hemoptysis, and chest pain. Dyspnea is defined as an abnormally uncomfortable awareness of the breathing. Hemoptysis is the coughing of blood in the sputum. In respiratory system examination, we study 4 headings: inspection, palpation, percussion, and auscultation. Percussion was absent in cardiovascular system. In inspection, we see shape and symmetry of the chest. The shape of the chest is normally bilateral, symmetric, and transverse in diameter is more than atrioposterior diameter. Tracheal shift can be assessed by looking for prominence of clavicular end of sternocleidomastoid muscle, which becomes more prominent on the side of the shift. This is known as trail sign. The movement of chest is normally equal on both sides. The movement is decreased on the side of disease. Then we see rate, rhythm, and depth of respiration. The normal respiratory rate is around 12 to 16 per minute. The tracheal and the apex beat are palpated to find out the shift of the mediastinum. The shift of the mediastinum to the side of disease occur in fibrosis and collapse. Mediastinum is pushed to the other side in the case of pleural effusion and pneumothorax. Then expansion of chest is measured and compared on both sides. Tactile vocal fremitus is detected with the flat of the hand placed on the chest of the ball. This occurs due to the transmission of sound wave produced in the larynx and proximal airways to the chest wall. Palpation also let us know about any tenderness present. Normally, the percussion note over the chest is resonant, but in the case of disease, it may be impaired or dull, stony dull, or a hyperresonant note is found. Normal liver dullness is masked in emphysema. In auscultation, we heard for normal breath sound. Normal breath sound heard over the chest wall are called vesicular. In case of disease, they may be bronchial breath sound and harsh vesicular with prolonged aspiration, as in case of COPD. Additional sound like wheezes, crackle, and pleural lub or are also found. Wheezes are high-pitched continuous musical sounds associated with narrowing of the airways. Crackles are bubbling or clicking, brief interrupted sound produced by the explosive opening of small airway due to sudden changes in gas pressure. Pleural lub is a lateral rubbing sound found in the case with pleural inflammation. This is the last slide. So thank you for watching video till here. If you have any suggestion or want video on any specific topic, don't forget to comment below, like and share the video, and also subscribe to the channel.